Hello, and welcome to the On the Couch podcast, the podcast that gives you the view from the therapist's chair. I'm your host, John Dennis, a licensed professional counselor. You're listening to OTC episode 34 with Carrie Nicklas of Parenting and Family Solutions. Oh, welcome back, OTC listeners. We have a bonus episode today. I got a chance to sit down and chat with Carrie Nicklas, who is a licensed professional counselor with Parenting and Family Solutions, and she specializes in working with children and teens, families, parents, just helping them improve their relationships and deal with their life issues. And she incorporates elements of play therapy into her outpatient practice. And she has just such a wealth of knowledge. She uses so many amazing techniques, including bibliotherapy, which we talk a little bit about, using books, sometimes children's books or other concepts to help teach concepts that they can then put into practice in their daily life. And she's just so good at what she does. She's so passionate, and that just comes through in the conversation. And it's so amazing in co-owning the practice to work alongside her and be able to refer families or children to her and just know the quality of care that she's going to be bringing to every session. It's just such a weight off of my mind knowing the work that she does and that she's right there for me to be able to refer to. So she's a huge addition to our team, and we're super blessed and excited to have her. So I hope you get a chance to listen in and take something from it. I have here with me today Carrie Nicklas, who is one of our licensed counselors at Parenting and Family Solutions, and she focuses on working with children and adolescents and parents. So, Carrie, welcome to the show.
Good morning. Thanks for having me.
Yeah, it's good to have you on. So, just give me the starter version. How did you get into counseling? How did you get your start in this crazy business?
Well, it kind of is a bit of a long story, but it's kind of a cool story. Counseling was never really on my radar until I was in my later 20s. My undergraduate degree is in communications, and I had a business minor. With that, I went into human resources. I really enjoyed the business environment. I really enjoyed working for a fast-paced office. I really enjoyed working in human resources and helping people find jobs that were a good fit for them. I had a couple of great jobs post-college, but then I decided to go ahead and stay home, be a stay-at-home mom once I had my first daughter. I remember one day sitting on the couch feeding my daughter, and just feeling very, very grateful for what I had. I was blessed with a great career so far. I had a great family. I was just very, very thankful that I could provide so much security and stability into my daughter's life. And then I started to reflect on how there's so many women and children out there who are not given that same stability and that same security early on in their life. And I felt an incredible compassion for women and children who were going through difficult times. So from there, I started to go into volunteer counseling. I went through a training program to do volunteer counseling at a local crisis pregnancy center, where there was young women coming in, dealing with a lot of issues, facing unplanned pregnancies or potentially being pregnant. So I was trained, and I found that to be a really, really cool niche for me. I really enjoyed working with those young women and their little ones. These are very young, vulnerable women and children who were coming in, and just I was able to connect with them as a young mom myself, but also kind of guide them and steer them and help them along the way. So from there, I did that for a little while until I had my second, and then I took a break. I had my hands full, but I never lost that passion for serving women and children. And so it was later, it was closer to the time when my second was school age, when I really felt like, okay, maybe I can go back into this counseling thing. But I needed my degree to do that. I didn't have the credentials. I didn't have the education to go into counseling professionally. So I took a big leap of faith. I've been out of school for like 16 years or so by then.
I'd like to point out that the jumping into the deep end with like crisis pregnancy counseling, you did not note that as like the giant leap of faith. The going back to school, you noted as the giant leap of faith. Wow. Yeah,
that was definitely a growth opportunity, or it was.
It's putting it very, very well.
Yeah. But when you have a heart to really reach out and serve, and you feel compassion for people in our community who are suffering, it was just a natural thing that came to connect with them.
Wow. Okay. So you took the leap. You went back to school.
Yes. So that was another stretching experience. Getting through graduate school with two little kids and working at that point. And that was, I again had a great support system, was able to get through my degree in about 4 years, and graduated. And then after graduation is where I got into the professional counseling. So my first job post-graduate school was in school-based outpatient counseling. School-based is a regular outpatient counseling position where I am assigned to a specific school, and I work in the school. I have an office in the school, and then I can go and get my little clients from their classroom, bring them back to my office, work with them therapeutically, and then return them back to their classroom. So it reduces the amount of time that the child is away from school. And it also makes it easier for parents that they don't have to be involved in transportation and scheduling. And so the child has more direct access to mental health services.
Which, I mean, obviously is a huge benefit because, in our outpatient office alone, but obviously throughout the country and throughout the world, kids missing school is not ideal, and that's always a barrier to services. So it's I kind of chuckled when you mentioned the little clients. I had this picture of Boss Baby with like the little suit.
Yeah, in the school setting, I didn't typically call them clients.
Kiddos.
I tend to call them my kids because, I'm working with teachers and I'm working with staff, and most teachers have their classroom and those are their kids. And so there's a bit of an ownership element. So I would often talk about my kids, and I had to always explain, okay, these are not my biological children. These, I have, 30, 40 kids that I care for, I see every day. In the school setting. And I loved it. I love working with the kids and just the bond, their energy, seeing them start to use the skills that I'm trying to work with them and teach them day to day in their school environment.
Well, and yeah, I mean, obviously, as you've been telling your story, I mean, the thing that's coming through is just your love and your passion for serving, kids and parents, families. So, yeah, that would you say that's your main area of focus, or yeah?
Yeah, I would say that's kind of the most natural fit for me. I have a heart to serve anybody who's suffering. I would never, if it's an older person, if it's,
Sure.
Someone who, yeah, I will. I don't close the door to anybody who wants to open up and share their story. But my most natural fit is going to be parents, women, and children, because that's what I've had the most experience with. That's the population I identify with the most, and where I've had the most experience and training. And you're right. Like, my heart, my passion is for children and adolescents who are going through difficult situations. And most of the time, young people do not have the ability to articulate with their vocabulary what they're feeling. And so I really try to meet them where they're at and give them those words of, I feel angry, I feel hurt, I feel sad, the feelings, to be able to begin to work through what they're experiencing, and then work with them from there. So I start from very, very basic skills and work up from there.
So, Carrie, I hear you talking about, who you enjoy working with. Are there any, parameters you set on things that you don't work with, or ages, or, certain issues?
Yeah, generally, I start with ages 5 and up, or school age and up. Kids that haven't been introduced to an academic environment yet tend to have a little more difficulty with my style of counseling, because I'm not like a certified play therapist that all we do is play. I do give some direction. I do need children to be able to have enough verbal skills to communicate. I need them to be able to follow basic directions of, okay, let's clean up the toys. Let's keep our shoes on. We don't jump on the furniture. So, some basic safety.
We don't spill hot chocolate.
We don't spill hot chocolate.
Yes.
Just some basic, social skills are generally started with that type of school structure that I'm accustomed to working with. So the preschool and younger age, my office isn't necessarily suitable for them. And it's better if they've had at least some structure from starting school. So usually kindergarten and up is the general age. The other thing, I do work with some children who are on the autism spectrum, and I'm more than happy to work with them. However, if they aren't potty trained yet, if they haven't accomplished that task yet, then I don't know that my office is the right setting for them.
Okay.
And while I do work with children who have some developmental delays, it depends on the severity of their developmental delay, on whether generally I need kids to be able to communicate, at like a age 5 and up level, and be potty trained and be able to follow simple directions.
Okay. Well, we're starting to kind of get into when somebody comes for a first session, can you kind of walk us through what is that? What should, a parent or a child expect? Yeah.
Sure. The first session, we call it an intake. One of the primary purposes I see of that is to make that initial connection, to help begin forming that therapeutic bond with the new client. But with that, I also have to cover a lot of the basic policies.
The business side.
The business side. So I, of course, any age client, I go over informed consent. I cover confidentiality. I cover, one of the things I really stress is how safety is my top priority. So I talk about safety factors, exceptions to confidentiality being their safety. If they're going to hurt themselves, if they're going to hurt somebody else, if somebody's hurting them, then I have to do it takes to keep them safe. And even the littlest clients, if they're sitting there on the floor, I try to get them to zero in on my face, and I will say that very clearly and concisely as I can to them so that they understand at their level.
That can be challenging, getting...
Yeah. Especially if they're not used to listening face to face. So, I do try to make sure that they understand some of those basic business principles and confidentiality before we get started.
Now, sorry to interrupt, but with that, parent and child in the same room, or you're just with the child, or
Yeah, most children are not comfortable being in a room by themselves without mom or dad during the first time.
You don't say.
And the last thing I want to do is scare them.
Yeah.
I want them to go, if they're not comfortable with me, that's perfectly fine. Another thing I do is I introduce them to my room and all of the different toys and activities that I have in the room. So while I'm covering some of the business stuff, if it doesn't pertain to the child, then I'm like, hey, you can get, the Barbies out. You can get the toys out. You can, make yourself comfortable while I talk to mom and dad. And then if I need to make sure that they understand something that I'm saying, then that's where I'm like, hey, so-and-so, I need you to, tune in and look at me a second. And then let me explain this. It's really important. And then you can go back to, building with Legos or whatever. So another thing I do in the intake is I'm going to, of course, cover a lot of the history of what the problems are. So I'm going to ask questions about, the family environment, family history. I'm going to ask questions about health, any medications. I often ask about sleeping habits because sleep can really make...
Yes, I'm well aware.
Sleep is a priority. Also, I'm going to try to tactfully hear what the biggest behavior problems are of the child, the presenting issues. What are the pressing issues that bring you into the counseling office? Okay. That, of course, is important information for me to gather in order to make an initial diagnosis. And then from there, I need to make a treatment plan. So I'm collaborating in the intake interview with the parent or the child and client, whatever age, to kind of get to the core issue, put together goals to help work towards resolving that issue. Okay. So by the end of that first session, the parents, client, and myself should be on the same page as far as what counseling is going to look like for the specific client and how we're going to kind of roll that out, at least in the first several sessions.
Okay. And I want to go back to the therapeutic bond and kind of getting into, okay, what are the issues that brought you here? I always think that's obviously such an important part of the therapy. I know a lot of counselors and social workers will tell you that, the treatment modality, quote unquote, comes secondary. That if you don't have that therapeutic bond, it doesn't matter what treatment modality you're using, it's not going to really do a whole lot. And I always would tell people, my job is sort of, to kind of boil it down for that first session, is my job is to meet you and within like 10 to 15 minutes make you feel comfortable enough to tell me the worst things that have ever happened to you, which is kind of an odd job. It's like an odd gig. Yeah.
It's not natural for people to come in and share their deepest issues with somebody that they've not met before. Right off the bat.
And how do you balance that therapeutic bond with, the parents explaining the clinical issues that brought them here, but at the same time, you don't want to like just rip the kid up one side and down the other. Absolutely. Or like make you the bad cop and that you're the principal's office. Mm-hmm. How do you try to balance that?
Right. usually the core issues or the most challenging issues are one of the last things that we talk about in that first session. Mm-hmm. So the first part of the session, I also talk to the child or teenager, whatever age they may be, about what their personal interests are, what their strengths are. I kind of try to get a sense of what this personality is like that's in front of me. So I'll ask about, what do you do in your free time? What are you good at? What do you like to play with? What do you do at recess? What do you like to eat? All of those get to know you, icebreaker types of questions. Because I really want to focus on whatever strengths they have and bring that into the therapeutic process as well. So I really try to focus on those positive things, and I often refer back to them as I'm making that initial connection. So focusing on the positive at the get-go can really help set the tone that this person is absolutely valuable, that they have strengths, that they are important part of their family or community or school or circle. And, maybe they've had some setbacks, but hey, that's what we're here for. We're going to work through those and get you to be the best person you can be.
Mm-hmm. Nice. Well, I know, like you said, you work with, anybody that is comfortable working with you and sharing their story. With the younger set, a lot of times you'll incorporate elements of play into the sessions. Can you kind of explain what does that look like? What does that entail?
Sure. Yeah, it really depends on the age of the client and their development and their interests. So if I have a teenager, middle school student, high school student, they want to do games or cards or whatever, fine. If they prefer to just sit on the couch and chat, that's fine too. So really, I leave it up to the client as far as what their interests are and what they like to do. For elementary age kids, I would say a majority of our sessions are doing some type of activity or play. The first purpose of play is to build that rapport, kind of going back to, the intake. I mentally take notes as far as what does this kid like to do in their spare time? Do they like to play Play-Doh? Do they like to do Barbies? Do they like to play with cars? Do they like board games or card games? So based on that information, I'm going to kind of, say, hey, I understand you love to play Play-Doh. Let's get the Play-Doh out and, play with that. So building rapport is a key part of the play that I do. Another thing I do with play is to get them just to relax and start talking about their feelings. So something, for example, I would do with that would be I play Uno a lot with my little clients. And
Uno champion, yes.
And so I make it therapeutic by correlating the colors of the cards to feelings. So when we play yellow cards, we talk about when we're happy. When we play blue cards, we talk about when we've been sad. Green cards are usually either jealous, or I go with the
color wheel, yeah.
Inside Out with the little character, the green character, disgust. So it's fun to hear what kids are disgusted about sometimes, and then red would be anger. So that just incorporating some therapeutic elements into a simple card game can get them starting to think and talk and process different types of emotions.
I find it can give you a really good sense of developmentally also where they're at. I mean, obviously you get a sense of fine motor stuff. You can tell they get really upset when they start to lose, and then they lose interest or change the game or change the rules or, things like that. There's just so many nuances to it, I find. Another purpose of play, especially with games like that, board games, card games, anything where there's a basic set of rules
and taking turns, that teaches basic social skills. Mm-hmm. It also teaches, depending on the game, it might teach some strategy, which leads into that executive functioning. How do you plan out your next move? With Jenga, that you're building a tower of blocks and you have to use self-control or you're going to knock the blocks down. Mm-hmm. So talk about self-control when we play Jenga, and how if you're running around the room and can't sit still, you're probably not going to be able to win. So let's see how still we can sit and focus and use those fine motor skills, and just try to help guide them through, okay, let's stop and think about your next move. And so I'm trying to really slow down and teach them those executive functioning skills as they're playing a game. When they start to get frustrated, that's where teaching frustration tolerance comes in. Sure. Okay, you know what? We're playing Chutes and Ladders and you just went down the longest slide in the game and you're ready to quit. Okay, I see you're frustrated. Let's talk about how we can deal with that type of frustration. Mm-hmm. Teaching, okay, well, let's slow down. Let's think about what we're feeling. Let's think about what we're thinking.
So in terms of a session, and the cheater's answer is, well, it depends. It's free form, but not in an intake session, how does that work with the parents? Is it everybody comes in at the beginning, or just the child, just the parents? How do you typically do that?
It depends on. I'm sorry?
I was laughing because that's the cheater's answer.
Let me qualify everything I say. But because I work with a wide range of ages, it really will vary a little bit based on their age and development and their anxiety level. Mm-hmm. So the younger the child, the more likely I'm going to bring back the parent and let the child more or less guide when they're comfortable having the parent wait in the waiting room. Generally speaking, I want to check in with parents every session, usually at the beginning of the session, at least touch base, how's the week going, any concerns. Definitely I want to hear the positives that they've seen in their child this past week or since I've seen them last. So I really appreciate when parents can come in and say, hey, my kiddo was doing a really great job of getting out of bed and getting ready for school this morning without, having, emotional or behavior meltdowns. And then I can kind of, affirm that positive behavior, talk about how the child has been, trying to work and get up and get to school or, so that's just a simple example of how I do a first session, or not a first session, but in the beginning session.
Yes. Yeah, and I usually tell the teenagers I work with, a lot of times I will start with them one-on-one, as long as they're comfortable with it. Like you said, it depends on their level of anxiety and comfortability and things like that. But yes, important to meet with the parents at some point, because sometimes people leave out things like, oh yeah, I tried to shave my sister's head in her sleep, or I got expelled yesterday. They leave important details out. So
Right.
So what do you feel are just some of the most important things you've learned up to this point in your counseling career?
I think one of the most important things that I've learned is the importance of the therapeutic relationship. I really want my clients to feel and understand how much I truly care about them, about their success, about what they're going through. It can sometimes, like you said, it's not natural to come in and you spill your guts. So sometimes it takes time to build trust. in a therapeutic relationship. So I do what I can to move that, make trust happen. But it's also helpful on the side of the client to understand the benefit of opening up and sharing and being honest in the counseling setting so that they can work towards their goals.
Sure.
Along with that, I've learned to go at the client's pace. I am eager to help people, and my eagerness can sometimes intimidate somebody from being honest about maybe a setback. So I am careful. I try to communicate that setbacks are normal in the process. I don't want people to come in and tell me things so that they think I'm just pleased with them, or I have certain expectations and I want them to meet those expectations. And if they don't, I'm going to be disappointed in them. Sure. I expect, like I said, I expect there to be ups and downs in the learning process and in the therapeutic process. So yeah, I've learned to meet the client where they're at. I want them to be honest and open and vulnerable when they're ready, and I want them to be able to go at their pace with the ups and downs in the process. And just kind of my role is to walk alongside them and support them and help them to reach their goals when they're ready.
Which, I mean, that's a tall order, that idea of, open and honest and vulnerable. I mean, for all of us, really. It's, but especially our clients, I think that's a pretty natural thing. You want your therapist to like you. You want your therapist to especially in the couples counseling, you want them to side with you. I'm right and the other person is wrong. And, I definitely see that where a lot of times, as the counselor, we're like, all right, we got to get going. We got a lot of ground to cover. And, the client, who sometimes they haven't been to counseling before ever, and they're like, I don't know how this works. Am I supposed to have an agenda? Like, do we just go where you want to go? Like, you're the therapist. What are we supposed to be talking about? And yeah, sometimes they are not as forthcoming or not as able to open up, and you have to, like you said, meet them where they're at and go at their pace. And so,
right.
So, what are major issues, major struggles that you see? I don't know, trending right now, I guess I would say, with the clients and the families that you work with. You're listening to OTC episode 34 with Carrie Nicklas of Parenting and Family Solutions. We'll be right back after a brief word from our sponsor.
Would you like to talk to a counselor but can't find the time? Would you rather talk to someone from the comfort of your own home? If so, Parenting and Family Solutions is here to help. We now offer teletherapy to all clients who reside in the state of Pennsylvania. Using our secure portal, you can have a video session with your counselor using a laptop, desktop computer, or smartphone. Visit our website to learn more at www.parentfamilysolutions.com or give us a call at 717-602-5560 to see if teletherapy might be a good fit for you. Let us help you build a stronger family and a healthier you.
One of the things that I see that's very common across all clients, all ages, is a struggle with healthy relationships. I see a lot of children and families struggling with the bonding and having that healthy relationship. When there's not enough bond, or there's not enough, emotional intimacy in those family relationships, oftentimes you'll see kids that are angry, they have anxiety, they may feel sad, somewhat depressed, And when they have those feelings, it often leads to behavior problems. Part of that all comes from, I believe, our culture of just being very task oriented. We thrive on being busy. It's hard for us to slow down and be present with the people that we love the most in our family. I think part of that, it has been increased by our obsession as a society with our screens.
Yep.
And I don't want to get on a soapbox about, technology use, because we all need it and we all use it. And at this point, we can't hardly live without it. But we tend to be consumed by it. And when we're raising children and families, especially little ones, if the child is struggling to connect with the family members because the family members, the parents, the caregivers are spending a lot of time being busy, taking care of the responsibilities. I mean, we have to work, we have to pay our bills, we have to, keep
Unfortunately,
up with
yes. Yeah.
We can't, it's very difficult to sit down and be present with the kids and, to put the phone aside and not be distracted by social media or, everything else that is going on in our world. But when, as parents, we don't take that time to really significantly bond with our children, that's sometimes one of the core issues that I see, is a lack of healthy, bonded, intimate, emotionally open relationships.
And it always makes me think of the song "Cats in the Cradle" by Harry Chapin.
Yeah.
Which I'm dating myself definitely by referencing that song because it was released in 1974, as Google has just told me.
Oh.
But for anybody that's not familiar with that song, you should listen to it. And obviously, back before a lot of the tech that we have today, but, the message still holds true of not valuing those relationships and, that attachment and making sure that that's a healthy attachment and a close bond. And then it, in the song, it has a huge impact on both the father and the son. So, and I think also the focus on transferring skills. A lot of times, especially in school-based therapy and things like that, they kind of hammer that a lot for the clinicians of like, you have to transfer skills, you have to teach the parents how to do this themselves. Do you find that's a large focus as well, as trying to equip them at home?
Absolutely. I do spend time, especially in the beginning of the therapy process, trying to spend time one-on-one with the parent without the child in the session. Like, I'll just have some parent sessions as we start therapy. That often helps the parents to kind of talk more openly about what are the behaviors that the child is presenting with. And then I can kind of ask more openly about their parenting style, and what is your daily routine like? Going back to basics of sleep, what kind of sleep hygiene habits? How are meals done? How are you spending your free time? So I like to get to know the parents and hear where the parents are coming from, and then gently guiding them in a direction of some healthy parenting strategies that will help their child, grow in the direction that they need to go in. So sometimes I'm just simple recommendations of let's try to eat family dinners together more frequently. Sleep hygiene, how can we get a healthy, bedtime established and a good sleep routine? How can we spend more time playing and interacting with the children on their level? Doing face-to-face, sitting on the floor building Legos, or, playing with whatever toys the child's interested in. I think as parents, we tend to want to drag our children along into our own interests. And sometimes that can create conflicts. If our child's not wired the way we are, it can be very challenging to find mutual interests and bond over them. So it takes some creativity. It can take some stretching on the parent's part, and getting a parent to maybe show interest in areas that they're not naturally interested in.
I think you may have just called out every sports parent out there who does not have a sports kid. So
yeah. It's challenging. It's very challenging. I think as parents, we naturally want our kids to have the same excitement over the same teams that we have, or whatever we're interested in. And when they find that boring, they're well, what in the world? Why is watching football boring to you? You know. And you just have to kind of learn that your child may be wired a little different than you. And how can you find a different thing to bond over?
And I guess I would throw in a disclaimer for any parents that are listening to this. Talking about the home environment, the relationships, and the family setting, and all the things that you've just referenced, we're not setting you up to bring children and youth in, or trying to pick you apart and rake mom or dad over the coals with you're the problem, you're the we're really just trying to get a sense of, okay, what does it look like, and what are some small things that we can tweak? I think so many parents are like, no, I don't have any problems. It's my kid. You need to fix my kid. Or what are you trying to pull here? Do you find that?
Right. Yes, sometimes there is a sense of okay, my kid's broken and I need an expert to figure out the problem and to fix the problem. And I absolutely want to do what I can to help the child work through whatever the problem is and get back on track. But I often will say to parents that I'm only with your child maybe a max of 1 hour a week in a therapy office. You are spending, how many how many hours a week with your child in the home or in the car, driving to different activities in school, or, so your influence on the child is so much greater than my hour a week in the therapeutic office. So I kind of help parents put that into perspective, that they are going to be so important in the progress of their child. I can come alongside you and help you develop the parenting strategies to make the healing process go quicker. But it's kind of up to you whether you use the suggestions or not. And as a parent, I try to do a lot of peer type of suggestions. I'm careful about what I disclose about my own family, but I want them to know that, hey, I'm a parent too. I've had sick kids. I've had, a lot of the same challenges that they have. And so I'm not here to criticize. I'm here to empathize.
Yeah, well said. Definitely. And can you share, obviously we've touched on a number of things, of different things you'll use with, Uno or Jenga. Are there any particular techniques or exercises that you like to use in working with your clients beyond those two? Or
Yeah, I generally try to use a lot of visual tools. I'm a visual person, strong visual learner, and I've learned, I think it's about 65% of our population is more of a visual learner. When I think of children especially, they can understand and learn new concepts usually easier if they have they can visualize something, or they have pictures, or using something they can see or touch or hold. I regularly use feeling charts or pictures to help them learn about different types of feelings. Having pictures of faces with different expressions really helps young clients really put the dots together, put the pieces together about what they're thinking and feeling and what that looks like. I use a lot of picture books with elementary age kids to help them learn and process their emotions. That helps them to kind of calm down, to focus. We can talk about the pictures. Oh, this child is, they have a frown on their face. What are they thinking? What are they feeling? What's happening in the picture? Oh, their friends are leaving them out. Have you ever felt like that? I use those visual aids frequently with children. The other thing I often do is I use worksheets or little workbooks, printables I print off, and then I have some more not exhaustive, but that sounds overwhelming.
It's an Encyclopedia Britannica.
I use age-appropriate workbooks. Let me put it that way.
Yes. No, I think that idea of, we all start off, for the most part, visual. Before that language development and things like that, we're learning by, for those of us that have sight, we're learning by what we can see, and so I think like you were saying, trying to connect the dots and help give a child, or like help raise their emotional IQ, I guess I would say, their ability to communicate and identify their emotions. And the feeling faces, I think. I use some worksheets myself and some different exercises to kind of help even with adults, trying to, okay, what are you thinking? What are you feeling? Yeah.
Right. I have a little tool I came across that I printed out. It's a circle, and inside the circle are things that we can control, and outside the circle are things that we cannot control. Oof. And that visual tool really helps children and adolescents kind of put into perspective, okay, we can control our attitude, we can control whether we do our homework or not, we can control our response to different triggers, but outside the circle, it's, we can't control other people.
Yeah, there's a lot outside that circle.
Yeah. And so a visual aid like that can really help them to understand a concept that is harder to understand without a visual aid. Mm-hmm. It just clicks quicker.
No, I think even for adults, a lot of times in working with them, when I give them things like that, when they see it drawn in front of them in their own handwriting, a lot of times it's like, wow, I never thought of that, or I never realized. I mean, even something as simple as just make a list of your stress producers and stress relievers. I mean, you can really see, like, gosh, the stress producers list is pretty long. And usually the stress reliever side is very scant.
Having it written down, having it in front of you to look at, to think through, it can really make those pieces come together, connect the dots quicker for a lot of people. Okay. The other thing I like to do, especially with kids in my therapy office, is having them have the opportunity to move in counseling, which isn't very traditional. When we think of counseling and therapy, it's the on the couch thing. Yeah.
They think it is the on the couch podcast. So.
Right. And little kids don't naturally sit for 55 minutes.
You don't say.
So I've learned to incorporate different types of, whether it's, playing with a Nerf basketball, or just, we move around the office, we're getting up, getting different toys out, putting them away, we're maybe sitting on the floor, we're sitting at a table, we're building things. So having them be themselves at their age and their development and giving them the freedom to move about during the therapy session, I find is really beneficial for their comfort. And it makes it more fun and engaging for me as well.
And I can definitely attest to this as your colleague, my office being just a few doors away. The jumping around, playing with the Nerf basketball or things like that. Like you said, I mean, so many kids. I mean, a lot of times, especially if they've just come from school, like they've just spent the day, sitting and being still and following the rules and not being active. And so a lot of times, they really need that. So what's something you wish, everybody knew ahead of time? If they were going to come to counseling with you, what's something you wish they knew?
Bottom line, I want them to be themselves. I want them to be real. I don't want them to feel like they have to be somebody or be something as they come into counseling. I want them to be comfortable in being authentic. I try to be a down-to-earth person and relatable, and I want people to feel that, like, come in as you are, just be yourself. We all struggle with different problems, different issues, different challenges at different stages in our lives. And I'm here to help you unpack that. I'm here to help you to work through that. And the sooner you can try to let a little bit of that guard down, the quicker we're going to be able to work towards your goals. But with that, kind of like what I said before, change doesn't always happen overnight. I wish I had a magic wand and just, fix the problem. Sometimes that's what people want, is to show up in a therapy office and the therapist to, wave the magic wand and fix the problems.
That's what we all want.
And in one session. But that's not usually how therapy works. So
Sadly, no. Yep.
Yeah, it can take some time. I want to work with the client through the process. And again, there's ups and downs. But over the course of the therapeutic process, at the end and working towards those goals, it can be very rewarding. The other thing I try to be upfront about is people usually sense that I do have a big heart. So as they're sitting there, sharing their pain, I'm, right there with them. I may tear up a little bit, and I, certainly, usually people don't mind that, but don't be afraid of that. I'm in emotional control, but I'm feeling your pain and I care deeply about that. But the flip side of that is when I see little steps of progress, that's super exciting to me. And so I point out their progress frequently, and I give them a lot of affirmation about that, a lot of congratulations. Hey, you made a small step in the right direction, and, congratulations on the hard work that it took to get through that small step. But then when they reach those bigger goals, I get really excited, and I feel proud of them. It's a privilege and an honor to be available and present with somebody who is open and vulnerable and willing to share their stuff, and then to get to the point where they've incorporated new tools and they work through difficult things, and they're doing fantastic. But sometimes at that point, we have to say goodbye, and that can be difficult too. But letting go of that therapy relationship is part of the therapeutic process, and just kind of, letting them take those tools and use them in their life and being successful. That's really exciting, but it can be a difficult step too.
I think that was so well said, and it always reminds me of Mary Poppins and just the idea of, it is a very odd but sacred role that we fill, but designed for a short amount of time. And we are blessed with the privilege, I would say, to walk with people through usually the worst parts of their lives, the most difficult things. And the idea is just to be there for the time that we're needed and help them sort of build up their own skill set and toolbox and then move out the door. And that's got to be hard for you, I would imagine, especially with the little ones, because it's
Sure.
a lot of times you're like, they're doing so well, and I enjoy seeing them and hearing how well they're doing, and then they're gone.
Right. Yeah, I mean, but that's part of the process.
Yeah.
And
you can't take them home with you.
Right. I'm thrilled to pieces for them. I'm excited for them, and I can kind of step back and appreciate their accomplishment, and then I turn my focus on to the next one that needs support, and I kind of can change gears and just keep on going.
Yeah. Wow. Well, Carrie, thank you so much for taking the time to be on. Is there anything else you'd want to share with folks that they should know about, working with you, or, if they're not in our area and they're looking to find a good therapist? I don't know, any other wisdom you'd impart?
Yeah, I know that it can be challenging to find therapists who have, the skills or the desire, the time in their schedules to work with children. If you have a child who is struggling with emotional or behavior problems, do your best to try to get them in either with a school-based counselor or a regular outpatient counselor. You might have to be on a waiting list for a little bit. Sometimes that is the case, but I believe it's worth it to get them into counseling if they're struggling with some stuff. Counselors want to collaborate with parents and children and help them reach their goals. The exciting thing about working with children is that as a therapist, I can give them these tools that can last over the course of their lifetime, which is really neat to think. And I also get excited about, if a child is having a positive experience in therapy at a young age, they're more likely to go back and get therapy or counseling in the future if they're struggling with another situation. So, their first experiences with counseling can really have a positive impact in multiple ways. So if you're a parent who's looking for, should I, wait and try to get them in, even though it's hard to find a therapist that has availability to work with children, it's worth it to try to get them in to get services because of the long-term positive impact that can be there.
And I think Nadine Burke-Harris, Dr. Harris, she's done a lot in the space of ACEs, the adverse childhood experiences, and just the impact that those can have on a person. And, with everything, I mean, that catchphrase of like early detection, early intervention is such a huge thing. But at the same time, it's never too late.
Right.
And again, I think that was such an important thing for people to hear. That idea of that first therapeutic experience can, pay off dividends down the road for if they have to go back. But at the same time, on the flip side, I would say if they don't have a good one, that's not going to be the way that it is with every counselor or every social worker.
Absolutely.
There are good ones out there. There are ones that there's a better fit or a better, skill set. Yeah.
Sure. Yeah, it can sometimes take a couple of trials and errors to find a therapist that you click with. If it's not the first one, that's okay. You can, there's others out there. And so if you have an experience with a counselor where you don't click, where there doesn't seem to be a good fit for that therapeutic relationship, don't give up. There's others out there, and you may find the next one may be someone you can click with better.
Sure. And I think, excuse me, just the one thing I would probably throw in with that, at least in my experience, what I usually talk with parents about is, especially in the space of divorce and separation and things like that, a lot of times it's almost this obligatory, we got to get our kids into counseling. We got to make sure that they're not, irreparably damaged. And sometimes it's too soon. Sometimes the kid does not want to be there, but the parent wants them there. And, I when I'm the therapist working in that space, a lot of times I'll tell parents, I'm going to give it the college try. I want to try to connect with them. I think they could benefit from it. But if it really goes on prolonged, where they're resistant and they're not interested, you can essentially do more damage for later down the road if they really get burnt out or turned off to the help. So.
Yeah, timing can be important.
Yeah. Man. Well, Carrie, thank you so much again for taking the time to be on the show. It's just so amazing getting to work alongside you and see the passion that you have for your kids, your clients. And I'm so looking forward to just watching your impact on the community and the work that you're doing, as you work with us here at Parenting and Family Solutions. So thank you and have a good rest of the day. Well, there you have it, OTC listeners. That pretty much puts episode 34 in the books. Carrie is just such an amazing counselor and clearly has such a calling for working with children and adolescents, and not everybody is called to that. Not everybody is gifted in it. Some, everybody has their sort of their niche and their ideal clients that they work with, and Carrie is just super passionate about the kids and the families that she gets to help and walk alongside. So I'm glad I got to share that episode and that conversation with you. In OTC episode 35, I'm going to be sharing a conversation with Megan Hunter, who is a co-founder of the High Conflict Institute out in California. I think back in episode, I want to say like in the 20s, I spoke with Bill Eddy of the High Conflict Institute. And Megan and I sat down to talk about her book, Dating Radar, which essentially teaches people how to spot narcissism and borderline personality disorder in the dating scene before you wind up getting, married or committed to somebody.
But these are folks whose operating system are telling them they need to pour on their best self. It's like a marketing campaign that they didn't even have to create. It's just what their brain's doing.
So check out that in OTC episode 35. Take care. If you liked what you heard, be sure to subscribe and review wherever you're catching this podcast at. You can check out detailed show notes and archived episodes at www.pfsonthecouch.com. If you want to stay up to date on future guests and contribute questions, be sure to follow us on your favorite social media platforms. The author and host of this podcast is not engaged in a therapeutic relationship with the listener and cannot give counseling advice without a confidential appointment. Listeners should be sure to consult with a licensed therapist in their area or seek emergency medical attention if they are experiencing psychological difficulty. A special thanks to the band The Topsy-Turvies for the show theme song. Their song, Like a Living Dead, can be found at topsyturvies.bandcamp.com. The bump interview track was the song 1973 by Bruno E. The author and host of this podcast is John Dennis. Special thanks to editor and show producer Trevor Groff.